Hello, everyone. My name is Camellia. I am a psychiatric mental health nurse practitioner, also known as a PMHNP. I'm also a nursing and mental health enthusiast. And I wanted to get on today to share a little bit about a question that's very popular and that gets asked a lot, especially to those of us that have traveled this NP journey, and we've advanced our degrees, and we have lots of people who are looking to advance their degrees. And so one of the questions that has come up a lot is how many years of nursing do I need, or how many years do I need as a nurse before I consider getting or advancing my degree? And so today, what I want to focus on is specifically the trajectory from being a nurse to a nurse practitioner. As we know, there are other ways and other avenues of advancing your degree in nursing, where you will not necessarily be practicing with patients. So I just want to share a little bit about sort of my thoughts and considerations around years of nursing or experience in nursing prior to becoming a PMHNP. So first, I want to say is there are programs that do allow you to transition from nursing, being a nurse, to a nurse practitioner with having minimal experience working with patients, minimal clinical experience. And I can remember when I was looking to see if I wanted to determining whether I wanted to do PMHNP versus an FNP, there were particular programs that actually required me to have at least 2 years of nursing experience before applying, and that was a part of the application criteria. So I think it's important that you, one, consider that, and also understand that there usually are reasons that that is in place. If we think about sort of your experience as a nurse, there used to be some data that supports, and I think this still stands, that it takes about 18 months for a new graduate nurse to become competent as a nurse. And so I think that's important because you have these sort of building blocks that you learn in nursing school. And when you actually start practicing as a nurse, then you're able to sort of start applying those things. And so I think that that's important for a few reasons, which I'll talk about here in just a minute. But it also means that your competency level changes as you go from one aspect of nursing to another. So, for example, if you're working in a different specialty, or if you are advancing your degree, understand that the process of becoming a nurse practitioner when you were a nurse before, that's the foundation of it, but it's not a linear role. So I think what's important here is that we consider that there are different things that can be really groomed as a nurse that can be beneficial for you as a nurse practitioner. Okay, so a few things that I've noted here, and it's sort of this gray area, and a lot of programs, I will say, don't require the 2 years of experience anymore. But I will say that from my own experience, as well as a few other things, there are some benefits to practicing as a nurse before you become a nurse practitioner. Now, where you fall in terms of how long you practice as a nurse gets very subjective. But I think what I'll mention here is that, one, some of the things that you may gain from being a nurse for some time, whether that is an extensive amount of time. Maybe you don't have to wait 11 years like I did. I actually did not go back to school. I pursued my certificate in nursing education probably about 8 or so years into nursing, and was an educator for a while, but then did not go back to get my advanced degree as a nurse practitioner until I was about 11 years into nursing. So I wouldn't advise anybody to wait that long, but I do think there were some specific things that experience helped me with. Now, keep in mind that I worked in different areas of nursing, and eventually I did get to becoming a behavioral health nurse in an acute care hospital, which was basic foundational practices and learning things that I learned as a nurse, and which fed directly into being a nurse practitioner or a PMHNP. So the first thing that I believe, and from my experience, that being a nurse for at least some time has taught me, and how it's helpful for me now that I'm on the side of the nurse as a nurse practitioner, is that it has helped me to be able to critically think. And I've talked about this in a few other videos. I'm actually going to do a video at some point soon about how to hone your skills in critical thinking. But that is one key aspect of nursing that never goes away. And I think that the more experience you have, the more things you see, you're able to apply, you're able to understand, and you're able to connect the dots that are definitely more important as you become a provider or a nurse practitioner. So critical thinking skills are definitely honed as a nurse, and that is something that feeds directly into becoming or being a nurse practitioner. There is no day as a PMHNP that I do not practice critical thinking. So I think just having some level of experience does actually help to just kind of groom those skills as a critical thinker, which is definitely necessary as a nurse practitioner. Having some level of experience also helps you to think through certain disease processes. It helps you to understand treatment. It helps you to kind of know the why behind things, because you really have to be able to understand the why when you are the person driving treatment as a nurse practitioner. So I think some experience does give you some insight. It gives you sometimes a better perspective as to how things and why things are being done and why you will be doing things as a nurse practitioner. Thirdly, I think it does help with communicating and learning the art of communication with patients, learning the art of active listening with patients. As a PMHNP, that's something that I still practice and I still utilize. But I think I had a fair foundation with working with patients in all populations, across all populations, that really helped me to hone this skill. That it's one that's highly, highly important as a PMHNP and as a provider. So when I say provider, I mean that you are actually driving the treatment for a patient as a nurse practitioner. So to answer the question of how many years of nursing do I need before I consider becoming a nurse practitioner, there is no absolute answer. And I think you guys have probably come to that realization that there is no absolute answer. However, I do think that what's beneficial for most is if you have an idea of where you are specific to some of those things that I just mentioned. So how are you with critical thinking? How are you with communicating with patients? Do you understand and have a good understanding of the disease processes that you're working with, whether that's a PMHNP or an FNP? Really having the foundational skills and understanding the treatment, understanding the diagnosis, understanding the illness, so that you can really connect the dots, because again, you are driving the treatment as a nurse practitioner. I also want to say that, it's important for you to just understand where you are. So only you can make that determination. I always like to tell people, like, you are your own expert. And what that means is you know exactly what you're feeling. You know where you are. You have a good idea of possibly where your skills may need to be groomed a little more, what you feel comfortable with. And also, if you've never worked with patients actively, then maybe your communication and learning how to communicate with patients hasn't been groomed as well, or hasn't been groomed enough. So just understanding where you are on your journey. There is no absolute answer. There's no magic number that will help you to be able to attain the skills that are necessary to move forward as a nurse practitioner. But I do have, I do have individuals who are pursuing this journey to think about the fact that being a nurse practitioner holds liability. So it's not just advancing your degree. You are actually going to be practicing. You're going to be treating individuals. You are going to be responsible for that treatment. So really take that into consideration. And if there are areas specifically with critical thinking, with active listening, with communicating with patients, understanding the disease processes and treatment and the why behind some of what is happening with patients, if you don't have a good grasp on that, keep that in mind, that you are going to be expected to be able to function at least that level as a nurse practitioner. So again, you are the only one that you're able to kind of determine, where you fall on the spectrum. But also sometimes you don't know what you don't know. And so I think some of the experience that you can gain in nursing, just to hone a lot of what I've talked about already, can really help you to understand what else is out there. What else am I needing to learn? And of course, some of that just comes with experience once you get into the role of a nurse practitioner. But the real beauty in this is that you do start over. You don't become competent as a nurse practitioner because you've had 20 years of experience as a nurse. The roles are not linear. It's not an absolute progression from nursing to being a nurse practitioner. And so while the skills can be foundational, and a lot of what I've talked about are based on foundational skills, just understand that you are going to start over to some degree and being able to practice in the role as a nurse practitioner. So maybe that gives someone or some of you some insight or a little bit of just kind of things to think about, things to consider if you are on this journey as a nurse. Maybe you just graduated, maybe you have goals of becoming a nurse practitioner, and you're just not sure where you fall on the spectrum. One, of course, some programs still require some experience, but secondly, just kind of consider where you fall with some of the skills that I've mentioned. And I'd love to hear from you guys, as I always mention. So please comment, ask questions. There's multiple ways to connect with me or to contact me personally if you'd like to, if you have particular questions. But think about these things as you are making these decisions that are very important. Again, knowing that there is the nurse practitioner role is very significant in that you hold some liability. So understanding the importance of being able to identify where you are, but also how to make decisions going forward. So again, comment below, ask questions, and I look forward to seeing you guys in the next video.